So, hey everybody, I'm Kelly. I'm head of adult services here at Cooper-Siegel Library, and I am with Julienne Hagan, who is a registered dietitian and diabetes educator who we have had for a few programs here at the library. And we're excited that we're going to get to talk to her today and record it so that people can watch this whenever they like and whenever they need a reminder of great tips and tricks when it comes to diabetes. So Julienne will tell you a little bit about herself and then, talk to us about type 2 diabetes. So Julienne, take it away.
Hi and happy as we speak. It's April. I guess it'll be May with maybe or later when you watch this, but I'm really happy to be here. I've been here before with Kelly and the Cooper-Siegel Library, and it is an honor to serve my community. I have a small private practice on Old Freeport Road, which is near the library, near the post office in O'Hara Township. And I also have a course called Eat Type 2. And so I'm really passionate about type 2 diabetes. And this webinar, my hope is to give you both an overview of what you can do to make your diabetes be better managed, improve your blood sugars, hopefully reduce or control your blood sugar and reduce the medication you need, possibly. And to give you some specific tools you can do that. One of the biggest things you're going to see is I'm going to talk about sources of carbohydrate as we go on. So you are going to learn where the heck carbohydrate comes from. So you're in the right place if you have type 2 diabetes. I will say you're in the right place if you love somebody who has type 2 diabetes. You may have symptoms of a high blood sugar, which include tiredness, increased urination, and thirst. You may know what your blood sugar is and would want it better. You may feel a little bit confused about what you're hearing and what you've read. Maybe you've gotten advice about what to do and maybe even taken some of that advice and still either it's not working, your blood sugar is still not where you want it, or you just think, I can't do this forever. So that hopefully you will have some of your questions answered here. I will say that one of the things that's a little confusing is that truly people are different in their diabetes. There is type 1 diabetes, which is people who have no insulin at all that they make, and they have to take insulin. And then there's type 2 diabetes, in which people are actually making their own insulin, but it's not enough. It's not doing what they need it to do. So they need additional strategies for lowering their blood sugar. And then actually there's some areas in between. And so depending on who you talk to, what you need to do or what they say you need to do is different. So if you want to have better diabetes control, you are going to feel better. You want to do what works for you, but I can tell you I'm not getting younger, I'm getting older. I don't want to feel deprived and I don't want to feel guilty. I want to do something that works. And that's what you want to do too, I bet. And so I'm going to give you a bit of this step-by-step information that is going to help you with that. I'm going to help give you a sustainable way to think and to eat for diabetes, type 2 diabetes. And this is one of my favorite quotes, that there are far better things ahead than what we leave behind. So I like to think that I'm not just telling you what you can't do, but I'm leading you and helping you to think about some of the things you can do that will actually make your life richer. It may be a new horizon. Sometimes the path is a little bumpy, but I don't think it's worse. I think there's lots of good things to do. And I just want to talk a little bit about my path, my journey with diabetes. I began working in diabetes when I graduated from Columbia University many years ago. And I got a job working at Albert Einstein College of Medicine in diabetes in the Bronx. And then I married my husband, this lovely man here who's sitting next to his mom, and his mom has type 2 diabetes. And my husband has prediabetes, and his identical twin brother also has prediabetes. So type 2 diabetes in particular, runs in families. As I said, I have a long history of working in diabetes actually, I'll be honest, 1984. I started working with a master's degree at Albert Einstein College of Medicine and got my first diabetes educator certification in 1990. So I've been doing this for a long time. And I'm currently in private practice, as I mentioned earlier, but it's the second time I've been in private practice. I was also in private practice in my 20s and 30s. Because I live in a family where diabetes exists, I live a diabetes conscious life. Here's me cooking, here's me bike riding, and these are some of the papers that I published both for consumers, the public, and for professional journals. So I'm going to talk about what you can do for your type 2 diabetes. And actually, I will say this is a slide from before we were virtual. So you can just take a minute to think about what is your goal for joining this webinar? What do you want to gain? And how do you get started? So there are 8 steps for taking care of your diabetes. These are steps that are actually well recognized by the Association of Diabetes Educators. The first step I added myself. And the reason I added this, own it, is because sometimes people with diabetes, I think all people, sometimes we think that our doctor is in charge. And the truth is, for type 2 diabetes, one of the primary treatments is lifestyle, and you are in charge of lifestyle. So that accepting responsibility for that, and also the fact that diabetes is one of these diseases that changes over time. And sometimes you can't control it with just lifestyle. And instead of thinking that you're a failure, sometimes the medications that your physician recommends are a really important part of the whole puzzle about how do you manage it, because managing it over the long term can give you a much better quality of life. We are going to spend a lot of time talking about how to eat for your diabetes. Additional steps that you can take are to move. Moving lowers or makes it easier for your body to use glucose and lowers your blood sugar. So it's really important. Seeing how you're doing, knowing what your blood sugar is, knowing what your lab results are, also an important part. Taking your medications, thinking about what is going on and how you're going to solve it, doing other things to reduce your risk, like having your feet checked, looking at your feet, getting your eyes checked, going to your doctor every 3 to 6 months, and then dealing with the kind of psychological burden of having diabetes, coping. That's one thing. The other thing is coping with life, which actually is even more important with diabetes, because being stressed out makes your diabetes control worse. So I'm not going to talk too much about owning it, except for the fact that there are some few things you can do: learning your diabetes related numbers, thinking about what you really want and what you're going to do. I've had patients where all they want to do is be sure their numbers are okay. I've had other patients who want them really, really good, down in the normal, non-diabetic range. I've had other patients where there's just certain things they want to do in life. Like, I want to ride a bike for a weekend and know that my blood sugar is going to be fine. So what you want makes a difference in how much you put in. Some of the things that you can look for that tell your doctor and tell you how healthy you are and what what you have to work on is your hemoglobin A1C, which is that first number right here, your cholesterol, your LDL, your HDL, your triglycerides, and your blood pressure. For some people, also some of their kidney function tests are also important. So these are all things that you can look at. And this little picture here is actually a worksheet that I use with my clients to help them to look at these numbers. Your A1C should be checked every 3 to 6 months. If it's less than 7, it's every 6 months. If it's if it's greater than 7, it's every 3 months. And then another way you can check yourself is this, a relatively new thing called time in range, which I'm not going to spend too much time on. You can also test your blood sugar, and these are some guidelines for fasting and pre-meal blood sugars, and after meal blood sugars. Now, I know you have the ability to look back at these slides, so I hope you'll take the time to write down these numbers, because I definitely have had patients who test their blood sugar, but unless their meter tells them it's high or low, they don't really know what it means. So before a meal, your blood sugar, before a meal or when you first wake up in the morning, your blood sugar should be between 80 and 130. If you're not on medication, 70 is also fine. If you're not on medication for your diabetes, 70 is also fine. And after a meal, but from the beginning of the meal to 2 hours later, your blood sugar should be less than 180. Okay, now we're going to kind of segue into talking more about food. Oops. And what you can do, what you need to know about food in order to begin to think about how you can use it as a tool to help you improve your blood sugar. So you can do things with food that lower your blood sugar. I shouldn't say you do things with food. I should say the way you eat can lower your blood sugar. So when you eat foods containing carbohydrate in particular, they are broken down and become blood glucose. That is like this important concept that you need to know, and that because we're going to talk about foods that have carbohydrate in them. So foods that have carbohydrate in them are broken down, they become glucose in the bloodstream. Then once they're in the bloodstream, they just stay in the bloodstream unless they have something that takes them out of the blood and into cells in the body that use them then to run this beautiful machine of a body that you have. In order to get from the blood into the cells, they need insulin. And one of the problems in type 2 diabetes is that process just doesn't work very well. The cell surface is resistant. It just won't work very well. And so many people, I would almost bear to say most people with type 2 diabetes actually have a lot of insulin, but it's not working very well. And so in a way, they have a lot, but it's still not enough. So you both have a lot and you don't have enough all at the same time. And therefore, part of the approach of diet is to see, or I don't want to say diet, the food we eat is to see if we can find a workaround. How can we deal with this in a way that helps you? So there are the ways, a little overlap here, but in the food category, there's both timing of food and the actual food you eat that make a difference. A low carbohydrate or any one thing that you've read about is not enough generally on its own. In other words, if I handed you a diet sheet and it was whatever, it's not enough information for you. It's not enough. There's not enough practical information. There's no secret formula to the diet that works for everyone. And this is true, like the American Diabetes Association just says there's no one diet that works. Everybody's different. So part of what I'm going to just give you is a few tools you can start to be a little bit more critical and start to think about what is happening in your life. So I believe that one of the ways to really find out what to do is to be very systematic about it. And one of the ways that you can be systematic is by eating a particular way and then finding out what your blood sugars are when you eat that way. So testing your blood sugar before and after meals. This carbohydrate conscious diet, timing is important, what you're eating is important, and amounts are important. So if you ask me, oh, can I eat blah, 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 XYZ? Can I drink milk? Can I eat this? Can I eat that? I mean, when are you going to eat it? How much are you going to eat? It's not just about one food being good food and the other food being bad food. And in fact, more than, I mean, of course, it's not great for anybody to eat, sugar-laden food, but depending on how you eat something with sugar in it, it may not really affect your blood sugar so terribly. So yes, we need to be conscious of sugar, but sugar is not poison. It's really about when, how much, exactly what you're eating. So many people believe that the diabetes meal plan means that you have to cut back on sugar and you have to eat very low carbohydrate, and it's just not true. Different people handle carbohydrate in different amounts and still get great results. I have this lady that I've been working with who's 79, and she, I've been working, she's been testing, and she actually can eat a lot of carbohydrate and her blood sugars are great. So, it's unusual that I see that, but I don't think she could eat a ton. She can't go eat cotton candy at Kennywood. But if she's a little bit careful, it's enough for her. I've seen other people that it's the opposite is true. So this is an example of meal timing. So whenever you eat a food, and I'm not talking about just a pasta meal here, I just put this here to mean you ate a meal. Whenever you eat a meal, your blood sugar goes up. So here we have 2 meals. Your blood sugar goes up pretty high twice. Here we have somebody who is eating 3 meals. Again, the food is not, don't look at these meals and think, oh, Julie says I should eat an egg every morning for breakfast. I'm not what I'm saying. These just represents meals with the same amount of carbohydrate. So if you have 3 meals and the same amount of carbohydrate spread across 3 meals, then just notice here that each peak is lower. So on average, you stay a little bit more in the range that we were talking about wanting to stay. So remember, that was 80 to 180. So after a meal, we don't really want to go over 180. So I always suggest to people that they definitely eat 3 meals a day. And for many people, depending on the timing of their meals, there may be time, especially one of the things I see is where they really need to eat an afternoon snack because it's been 4 or 5 hours since they've eaten, they're hungry. And if you get too hungry, what happens? You eat a lot of food. And so then they overdo on dinner if they get too hungry. So there's nothing wrong with eating a snack if you need one. Ideally, a snack would be between 3 and 5 hours after a meal. It wouldn't be 2 hours or 1 hour after a meal. Then the question is, well, what kind of food should I eat? What food choices are the best for me? So all food choices are in the range of what I think I'd like you to consider, but foods that contain carbohydrates are the foods that we are most concerned about, because if you remember that earlier slide, foods that contain carbohydrates are the things that raise your blood sugar. One of the ways that you can find out how much carbohydrate is a food is to read the label on the back of the package called a nutrition facts label. So I'm going to go through here some foods that contain carbohydrates. And one of the slides that I've added to this is foods that don't contain carbohydrates, because it's nice to know what you can eat without affecting your blood sugar. So foods that contain carbohydrates include grains. Now, grains are things like wheat and oatmeal and cornmeal and anything that kind of grows on a stalk in a field. The thing is that there are usually we use grain to make other products like pasta, bread, crackers, pastries, all kinds of things. So if it has grain in it, it has carbohydrate in it. Another food category that has carbohydrate in it is starchy vegetables. Now this includes, actually corn is here. Technically corn is a grain, but so you can put it wherever you want, but corn is technically grain. Potatoes, things like pinto beans, lentils, split peas are legumes. Green peas are legumes, pumpkin, winter squash are all starchy vegetables. Potatoes, I already said that. So the kind of starchy component of your plate. Additional foods are, oops, not the slide I want. Okay. Foods that have natural sugar is fruit. Fruit is 100% carbohydrate. It is the carbohydrate that's in it is natural sugar. It affects your blood sugar, in the same way that other carbohydrates affect your blood sugar. Fruit juices, the carbohydrate in milk, the lactose in milk, the lactose that's in yogurt. And the reason I put plain here is because if I said any old yogurt, then it might also have sugar added to it. So these are just foods that if they're just plain, they still have carbohydrate in them. They have no sugar added to them. They still have carbohydrate in them. But then there's this whole world of foods that have sweeteners added to it. And it doesn't matter really whether they're whether it's sugar, table sugar, or whether it's honey. And we're going to talk about that in the next slide. It still has carbohydrate in it. And there are drinks and juices and jellies and jams and smoothies, and those cinnamon rolls that we were talking about is the grain with then the sugar added to it. Sugar is found in condiments like ketchup. It's found in milk like vanilla, vanilla milk substitutes, chocolate milk, and it's found in sweetened yogurts like the little 5-ounce yogurts that you get in the grocery store. So carbs are found everywhere. And when I'm telling you this, I'm not telling you what to eat. I'm telling you that they're not just in breads, because one of the things I hear is people who think breads and pasta and maybe potatoes, those are the foods they should avoid. But in terms of your blood sugar, all of these foods affect your blood sugar. And what I was saying earlier is that distributing these foods throughout the day can really help. There are great nutrients in these food groups. So I want you to eat some fruit, some grains like bread, what else did I include here? Some starchy vegetables. But I don't want you to eat huge quantities, and I want you to distribute them throughout the day. Just quick review of names for names other than that sugar has other than sugar. So if you look at this or look back at this, it's table sugar, brown sugar, molasses, honey, beet sugar, cane sugar, confectioner sugar, powdered sugar, turbinado sugar, maple syrup, agave nectar, fructose, lactose, sorbitol. The only things that add sweetness to foods that don't have carbohydrates are things that don't have calories. So sugar-free sweeteners, artificial sweeteners, substitute sweeteners. So if they don't have calories, they can't have carbohydrates because carbohydrates have calories. Just a quick review of a food label, because one of the things I see is people who pick up a food label and they see sugar in it and they think, I can't eat it. Whereas what the most important thing, of course, sugar has no health benefits, but the main thing is the biggest thing that's going to affect your blood sugar is how much carbohydrate it has in it. And I'll tell a little story here about going to Ohio Pile with my husband who has pre-diabetes, and because I work in diabetes, kind of conscious of what he's going to do for snack foods around me. And so he went in the little corner store there and came out with this smoothie, like a packaged kind of smoothie that had no sugar in it. It was like all this fruit. And then he had a thing of pretzels. He had also checked the ingredient label, pretzels, no sugar, but both of them had 85 grams of carbohydrate in the servings. So it meant that in one little snack, he had like 170 grams of carbohydrate, which is huge. So I guess the lesson here is just to tell you, yes, of course, you don't want things that are packed with sugar because they're not that healthy, not healthy for you, and they're not that healthy for anybody else, But in terms of the impact on your blood sugar, the total is really what you want to look at. And one of the questions that I have frequently received is, how much carbohydrate should I eat? And let me say that there is no answer for that. The range that I have seen work for people is somewhere between 30 and say 75 to 90 grams a day per meal. The people that are able to eat that high level are usually men who are physically active. The lower levels, 30, 45, 60, are going to be men that aren't as active and women. So I hope that that gives you a little guidance on that. The woman that I was telling you about early, this 79-year-old, she ended up, I think, with 75 grams at some of her meals because she was a very active lady and she was running around, and she was not overweight. And so she was able to handle it. She actually had pre-diabetes, not diabetes. So that was probably part of it. So big range from 30 to about 90 grams of carbohydrate per meal. If you had to ask me where to start, I would probably say somewhere around 45. I don't know you, so I can't tell you exactly, but a lot of people will tolerate that 30 to 45, say 45 grams per meal. So the good news is there are lots of foods that don't contain a lot of carbohydrate at all that you can eat. And other than the fact that maybe they have a lot of calories in them, and if you're watching your weight, maybe you have to think about it that way. But a lot of foods don't affect your blood sugar, and especially around the holidays where there's a lot of food, it's good to know what you can eat. So some of the no carbohydrate containing foods are nuts, nut butters of all kinds, almond butter, cashew butter, peanut butter, seeds, flaxseed, pumpkin seeds, sesame seeds, sunflower. You tell me another kind of seed I haven't mentioned, and it will also not have carbohydrate in it, or it has such a teeny weeny amount that it doesn't matter. So if you tell me something has 1 gram of carbohydrate in it, that is not even worth mentioning. All the protein foods have protein and fat in them. They do not have carbohydrate in them unless they are processed and carbohydrate is added. So for example, getting chicken nuggets are going to have carbohydrate. They might have some breading added. They might have breading on the outside. So, or fish sticks that you buy at the grocery store, they have breading on them. The frying doesn't add any carbohydrate, but the breading does. So condiments, I put in this list because they're very low in carbohydrate. If you drink a bottle of ketchup, maybe it will add up, but most people have, a tablespoon or 2 tablespoons, and in small quantities, that just doesn't have enough carbohydrate that it has a very big impact for most people. Fats, oils of all kinds. I don't care what kind it is. Olive oil, avocado oil, sunflower, safflower, corn oil. They do not have carbohydrates in them. Margarine, butter, mayonnaise, they do not have carbohydrates in them. So no need to go look them up and figure out how many carbohydrates they have, because they don't have very many. And we already talked about sweeteners and sugar substitutes. In addition, foods that have very little carbohydrate in them include what I call non-starchy vegetables. Now, I purposely made this list long, and I am not going to read it. But the reason I made it long is because first of all, the most common vegetable eaten in the United States is a potato, and then I think followed by like corn. And then I also hear a lot about green beans. But what I feel, so I'm a dietitian, I've been a dietitian for 150 years. And what I have learned is there is a world of vegetables out there. And the problem is learning how to make them so that they're good. And so that is the challenge, is to find ways of making these vegetables that works for you. Many cultures in the world who don't eat as much meat as the United States does have amazing ways of making vegetables. It's true if you go to Italy, they make all kinds of vegetables sauteed with a little garlic and oil. They're a big component of the meal. If you go to the Middle East or eat Middle Eastern food in the United States, there's salads and sauteed kales and all kinds of great ethnic food and even American food that uses these non-starchy vegetables. So please come back to this list later and look at it and write some of these things down and play around with new ways of making these foods, these non-starchy vegetables, which have very little impact on your blood sugar. For people with type 2 diabetes, one of the recommendations is that for your lunch and dinner, at least that half of your plate consists of these kinds of this non-starchy vegetable category of foods. So that's a lot of green beans. So I think we all need, and you know, you're going to turn into a rabbit if you eat salad every meal. So there are a lot of ways to do this. Now, this is something I think is very important. And that is, how much are you eating? So you might think, oh, I shouldn't eat that, or I should eat that. But portion size determines everything. If one food doesn't have many carbohydrates in it, but you eat a mound of it, wow, it can add up. If another food has more carbohydrates, but all you do is take a bite, it's not going to make much of a difference. So really, amount matters. And because the total carbohydrate is what matters, it affects how much your blood sugar goes up. And this is a good example. And again, you can imagine this is pasta if you want, but a little tiny bit of pasta is one thing. A big mound of pasta is something entirely different. So I'm talking about pasta here, but actually I'm talking about anything. Again, a bite is different than a piece, is different than a whole, whatever, cake pie plate. And this is just an image of some of the tools that I use to help people grasp some of the concepts we're talking about. Measuring and weighing your food is not always important. For some people it is. Carbohydrate counting, not necessary for everyone. For some people, it's just what they need and it's what they want. So I have had patients who are definitely successful without having to do that. And this picture right here that it looks like a plate, this comes from the American Diabetes Association, and it kind of spells out like what are non-starchy vegetables and what are starches and what are proteins. And as you can see here, I don't know, it's a little small, but half of the plate is filled with carrots and green beans, which are non-starchy vegetables. 1/4 of the plate is filled with potatoes, and another 1/4 of the plate is filled with chicken. And so that's actually a pretty easy concept to start to apply today. And so there are more strategies, which actually I'm not going to talk too much about today, but they have a minor impact compared to these impacts. Let me give you a few examples. So actually, carbohydrate counting, I just mentioned. Blood glucose monitoring tells you how you're doing. Exercising, especially after a meal, can be helpful because it can lower your blood sugar from the meal you just ate. The whole grains have been shown to have a beneficial effect. High fiber foods, especially high soluble fiber foods, which includes things like legumes, and psyllium, which is like, what do they call it, Metamucil, can have a beneficial impact. The Mediterranean diet is very much like the picture I just showed you, with the 1/4 of the plate as meat, 1/4 is starch, and half of the plate as non-starchy vegetable. And there I am with my self-glucose monitoring again. So, rather than putting out in front of yourself what you think this beautiful way that you should be doing things, what I like to do is look at where you were and how you've changed, and then how to move forward. And just a small example is I'm originally from Tennessee, and I grew up on fried chicken and just macaroni and cheese and some bacon grease on the back of the stove. And I look at where I am now, which is not perfection, but I've been a long way. And now, of course, we always can be better. We're never going to reach perfection. So look at where you've been, how you've changed, pat yourself on the back, and then take some steps in the direction of even being better. Sometimes the smallest step in the right direction ends up being the biggest step of your life. Tiptoe if you must, but take the next step. Don't feel like you have to be perfect. Just move, just take a step in the right direction. You are not alone. I'm just going to give a couple of case studies and I'm going to wind up, which is this one of my patients who came to me. He had retired. He had an A1C of 7.8. Remember that the recommendation is less than 7. he had high blood pressure. And I have to tell you, everybody in his family died of strokes. It was kind of scary for me as a provider to have somebody where I thought, wow, you have a 30% chance of having a stroke in 10 years. So he took some of the recommendations that we're talking about. He started testing his blood sugar. He started walking, even though he resisted it. He lost 12 pounds without having to calorie count or do anything crazy. And his A1C went down to 5.8, and he's on no medication. So big things can happen. I have another patient, Janet, who works at a church, pretty sedentary job. And she always was exhausted. When you have a high blood sugar, you can be tired in addition to work and home and all the other things you have to do. Her husband brought junk food into the house, which was really hard for her because she would usually break down and start eating it. So we worked through how to deal with some of the food that came into the house. She talked to her husband. Her husband ended up not bringing the food into the kitchen, but taking it into his office. She lost 11 pounds and her A1C went down to 5.8, which is just a little tiny bit above normal. So anyway, this is hopefully will give you a really good start about what kinds of things you can do. Feeling frustrated, feeling guilty about what you're doing, feeling like you just can't do it doesn't feel good, and you can do it. Only 6.8% of people with diabetes have been to a diabetes educator, which actually now is called diabetes care and education specialist. And so it is confusing out there. So if you can find a diabetes educator that you can see associated with your health plan, that can be beneficial. Dietitians can be beneficial, although I would recommend that you find one that is specializes in diabetes, because I do see people that come to me and have, I think, not bad information, but it's not associated with results. And I think what you have to do is look at your results and see whether you're achieving them. And anyway, so you can do it, rely on, support is very important, whether it's from your family, your health professionals, whether you find an online diabetes support group, whatever, it's important. And this like a little bit of just a little information that I have a program called How to Eat for Type 2 Diabetes that I developed because I was just feeling like there wasn't enough information out there for people with diabetes, for type 2 diabetes. And so I have this program. You're also welcome to contact me. I'm gonna go here. Email me if you'd like. My name is Julienne Hagan. I am in the Fox Chapel area school district area. I would be happy to answer your questions. I take insurance. I have this course that I offer. So on that note, I'm going to stop sharing my screen and I'm going to see if anybody has any questions, or I guess if Kelly has any questions.
Yeah, that was just so helpful and informative. And I think it's really encouraging information. I think that's one of the key parts of what you've presented in the past too, just so that people don't feel discouraged or defeated before they even get started. So that's so helpful. Do you have time for a question or two?
I do. I have about 5 minutes.
Because I had a question. So low carb diets are kind of a fad, there's all kinds of them kind of going around. And what do you think of those? Like, is that something you recommend that people do? Yeah.
Well, so I have to say, I totally understand why it's confusing, because we say, oh yeah, all these foods have carbs in them. Carbs raise your blood sugar. So you've a little bit have this feeling like, oh, I shouldn't eat them, right? Yeah. If I don't want to raise my blood sugar, I should just not eat those foods, which then results in a low carbohydrate diet. But let's talk about the kinds of foods we just talked about that have carbohydrate in them. We talked about milk. We talked about grains. We talked about starchy vegetables. What else? Seems like the things that don't have carbs in them are fats and proteins. So we have to actually, even for these really low carb diets, some of the non-starchy vegetables might even be left out. So it's kind of like, what can you eat? And so from a nutrition standpoint, I get concerned, right? I just like, well, how does one do when they don't get potassium from fruits and vegetables, and they don't get they don't get calcium from milk and whatnot. So that's one thing, is good nutrition. The other thing is, a lot of times when people eat low carbohydrate diets, they just kind of think anything that's got fat and protein in it is great. And they eat steaks and tons of cheese. And those foods are very high in saturated fat. One is all Americans, irregardless of diabetes, number one killer, heart disease. So what affects heart disease? Saturated fat. So what is one of the increased risk of having diabetes? Heart disease. So I would say that people with diabetes do not need to be eating a high saturated fat diet. If one chooses a low carbohydrate diet, then the kinds of fat becomes very important. So what unsaturated fat or polyunsaturated fat that comes from things like, corn oil, safflower oil, sunflower oil, even the monounsaturated fats like olive oil. Those are the kind of fats you need, which really means you need to be eating pretty lean meats and then using these other fats. I don't know what you do with fats when you're not eating anything else. Put a lot of, So that's another thing. And the other thing is, if you're in fact following a really low carbohydrate diet, and you can be in ketosis and you need to be medically monitored, that can be unsafe.
Yeah, so it's a little bit dangerous. So it's not something to just be like, oh, that's the ticket and that's the answer. I don't have to think about anything, just do that.
Right. And actually, for a lot of people, it's not sustainable.
Right.
They want to eat with their family and friends, and it's hard if you're just eating meat.
And you need some carbs. I mean, bodies need some carbs.
Yeah. Or you go into ketosis.
Right.
I mean, this is one of, I think, from a medical necessity thing, there's been a lot of debate about that. How many carbs do you really need? I have read things where it says 135 grams a day, and I've read things where that's not true. So I don't know how much you need, but there's these other reasons to be careful.
Well, again, I so appreciate this. I think everyone else will appreciate the information, and certainly getting in touch with you if they need support and help. This is great that you're kind of right here in our neck of the woods. And and thanks again for doing this. And I'll put your contact information on the description so people can get in touch with you and find your website. So
thanks. So Kelly, the other thing I would say is, I love, even though I wish you were all right here so I could see your faces, I'm really happy to serve my community by sharing what information I have. So if you have some kind of nutrition, diabetes related subject that you're really interested in, let Kelly know. She's at the library, and it could be the beginning of a future webinar.
Yeah, we would love to figure out another, like we've done some good stuff with you, so we can, if people have other things they're interested in, then let us know and we'll get something going. So
anyway, thank you very much.
All right. Thank you. And thanks everyone.